on Nutrition and Wellness. And this project brings together perspectives from a variety of different fields, including public health, marketing, and nutrition education in order to address obesity. The work by the Project on Nutrition and Wellness that we will be discussing in the webinar today will be the Grocery Retail Scorecard. And this effort has the goal of helping retailers to prompt consumers to purchase healthier and more nutritious options and products. The Grocery Retail Scorecard is designed so that it will benefit both retailers and consumers. And with the use of the Grocery Retail Scorecard, learning about the Grocery Retail Scorecard today will be very important for the ICCR members on the line with our current engagements with companies in the retail sector and also the food and beverage sector. And our shareholder engagement efforts on nutrition and addressing the risks of obesity will actually be coming together in a roundtable that we'll be holding in March, which is titled Responsible Marketing to Children at Retail, how retailers can support and complement food industry efforts to nutritionally improve the mix of foods advertised to children. The Retailer Roundtable will look at the placement and marketing of private label products as well as in-store forms of marketing, and we hope that it will encourage a dialogue that will help develop steps that retailers can take to help improve the nutritional mix of marketing to children. Today we will have 5 speakers to discuss different aspects of the Grocery Retail Scorecard. Each of our speakers will provide an introduction about their organizations and their work, and then we'll move into discussing the agenda topics. For ICCR members, this agenda is posted in the food section of the members area, so you can access it there. The topics that we're going to be discussing are why the scorecard was developed and how this was done. There will be an overview of the scorecard and sample strategies grocery retailers can implement, the retailer response to the scorecard, and a discussion on how organizations can use the scorecard. And after that presentation from the speakers, we're going to move into a Q&A, which will address how socially responsible investors can make use of the scorecard. If during the webinar you do have a question, we ask that you please click the raise your hand button, and then we'll come to your question during the Q&A section of the webinar. It is possible for you to write in the question box if you have a question, but we do prefer that you choose the raise your hand option so we can call on you when we do get to the Q&A. I do want to introduce our speakers today. We're very happy to have you with us. Julie Garrell, the Director of the Convergence Center's Project on Nutrition and Wellness. Amy Slechta, the Senior Associate with the Project on Nutrition and Wellness. Adam Brumberg, the Research Specialist in the Charles H. Dyson School of Applied Economics and Management at Cornell University, and also the Deputy Director of the Food and Brand Lab. Sarita Moss from the University of Delaware. And we have 2 representatives from the Partnership for a Healthier America, Sue Roberts, the Vice President of Strategic Initiatives, and Pamela Long, the Director of Strategy. So with that, I do thank you all for joining us today, and I will turn the webinar over to Julie.
Good morning, everybody. This is Julie Garrell, and I'm joined by Amy Slechta.
Hi, good morning.
I'm going to have Amy deliver just a bit of background on PNW, and then we'll take it from there.
Great. So PNW began in about approximately July of 2012, and our goal was to bring these disparate stakeholders together to kind of break down the work that was going on in silos and to look at opportunities for cross-sectoral action. So among our stakeholders, we have representatives from the food industry, CPG companies like Campbell Soup, Nestle, and Pepsi. We have a number of grocery retailers, public and community health voices, and academics, and just a number of other organizations and groups that have any sort of influence or knowledge of consumer behavior choice around food decision making. And so we wanted to bring these groups together to build relationships and trust, and from there to look at some of the barriers that each sector faces in promoting healthier eating among consumers, and then look at using those barriers, look at opportunities to create win-win solutions for all of these groups at the table. And about halfway through the PNW dialogue, we did an assessment of what was already going on in the field of building consumer demand for healthier eating and looking at the areas, the white space areas, to grow or to develop programs that didn't exist. And so what we found was that the retail space is a very underdeveloped area in terms of promoting healthier eating. And so having brought together the Consumer Food and Brand Lab, as well as our retail advisors and our public health advisors, we wanted to take a look at what we could do within the retail space. And from there, we looked at using kind of the USDA Smarter Lunchroom Assessment Scorecard, which was developed by the Cornell Food and Brand Lab, and creating a similar tool for retailers. So creating a set of strategies that they could implement at low or no cost, and building revenue in terms of healthier purchases. So as Sarah mentioned, it would be a win for retailers as well as consumers and the public health.
Great, Julie. Thank you. Do you want others to introduce themselves now, or do you want to just keep going with the main points of the agenda?
If we could have a brief introduction from everyone, that would be great.
Great, thank you. Go ahead. Who's next? Adam, do you want to go ahead?
We could turn to Sarita Moss if Adam's not available.
Thank you.
Looks like we're just trying to make sure that we've got everyone unmuted.
Well, in the interest of time, we will email. We'll email our colleagues at these other organizations.
Sarita, are you there? Looks like Sarita might have had a problem muting herself. We're going to try to get her back on the line.
Well, based on the agenda that we have, maybe we could have each speaker introduce themselves when we get to their section, and can move into point 2 of the agenda on the Grocery Retail Scorecard, which features Julie and Amy speaking first.
Okay, hi everyone. Sorry, this is Amy again. So we began with an initial meeting at the Cornell Food and Brand Lab with a number of our retail advisors as well as our public health advisors. And from there, we started to look at specific strategies that could be included in the Grocery Retail Scorecard. And so we'll let Adam go into the details on that, but a lot of this research comes from their existing, the Cornell Food and Brand Lab's existing work with grocery retail stores both in the US as well as in Europe. And then from there, we brainstormed additional ideas that could then be tested within the retail space so that this entire set of strategies would have an evidence basis. And so from there, can everyone hear me okay? So from there, we worked 6 to 12 months with.
I do too.
everyone hear us?
Yes.
Yes, I can hear
now we
you.
can hear you.
Okay, great. So we tested out the strategies within the store. The PNW team did this as well as our retail and public health advisors. And as we went through different phases of testing, we refined the scorecard strategies to make sure that they were able to be understood by the user, that they were feasible and implementable, and that they really got to the goal of increasing sales of healthier foods. And then as you will hear from Sarita, we looked at really ensuring that the scorecard strategies would be adoptable by retailers. So we wanted to look at the different attitudes and kind of perceptions of these strategies from the perspective of C-suite, the C-suite level, as well as store managers and the different managers within the retail sector. Julie, do you want to add anything?
No, I think that's great. If Adam can be heard, I think it's his turn to present. Adam, can you try to get your slides posted?
Now I have that screen. You have. These are the worst.
Adam, are you there? Oh, there we go. Okay, we're seeing your screen now.
I am seeing that there's a red line next to his presenter button. Oh, there we go. It looks like things should be up and running.
You guys hear me now?
Yes. Hi, Adam.
Okay, there we go. Okay, yeah, I was
Sarah, I
ready
think
to go,
it's
but
okay. We just want to have everyone mute themselves because there's an echo that we can hear.
Yep.
Yes, if we could just set.
Okay. Oh, there. Okay, am I hearable? Oh, okay, you're all muted. Okay, I'm going to assume that everybody can hear me now because everybody's muted. The reverb is
Yeah,
gone.
sorry, we can hear you. Adam, I just muted everyone else except you.
Great. Okay, thanks very much. I will continue on. All right, very good. Thanks, everybody, and thanks for tuning in for the webinar this morning. It's great to have an opportunity to present the scorecard, which many people on the call have worked hard on here. And so I'm going to give you a little background. So basically, just who we are. I mentioned this before. We're a consumer behavior research lab. Well, I mentioned it, but nobody could hear me. Based at Cornell University, we do research into how environment impacts food choices. We work everywhere from people's homes to restaurants to military bases to corporate cafeterias to thousands of school cafeterias around the country, convenience stores, supermarkets, anywhere. We like to say anywhere a food decision is made, we have done research to see what factors other than our conscious choices impact those factors. We've worked with government, with industry, and with private foundations as well. And we've been working with Convergence Group for about 2 years now on various initiatives, in particular the scorecard for supermarket retail in particular. So just very quickly, I'm going to give you a couple of little snapshots into some of the things that help drive choices. Everybody out there who's eating lunch while paying attention to this webinar, I'm sure there are a few of you. If you are eating unportioned food in front of the screen and distraction, you will eat 28% more because your job when you have food in front of you is to eat it, and we all like to do our jobs. Larger plate, larger meal. This is one of our more famous results. Every 2-inch increase in plate size results in about 25% more that Americans serve ourselves. Americans eat 92% of what we serve ourselves. You do the math over the course of the year. Ordinarily, your stomach and brain have about a 20-minute disconnect, so you're full about 20 minutes before you really feel it. So if you use a smaller plate, you can eat less food and still satisfy yourself. We're not super great at using information. We conducted a study where we gave everybody fat-free granola and then asked them to, told half the group they were eating fat-free, the other half thought they were eating regular granola. The fat-free people ate 35% more volume because, for two reasons. One, they assumed that with a fat-free item they'd need more to satiate themselves, and also because they were spending, but more importantly, they were spending the calorie savings. So we reward ourselves not always in the best way for what we think of as good behavior. And finally, out of sight, out of mind is a real thing. We did a experiment here in our building where we gave all the admins candy dishes and then secretly and evilly filled them every night after they had gone home. Every 3 feet further away from where your seat is that the candy dish was placed was an additional 3 fewer candies that were eaten. Over the course of a week, you can add up the calories, and it makes a big difference. So what we know about food decisions, and you can apply this to decision making in general. We have two systems: the deliberative, the rational system, the one we try to use, the one we tell ourselves we use, where we consider information, we weigh options, and we make what we think is the best and most optimal choice for us. In reality, most of the time we use our emotional choices, or our emotional system, which is where we're just responding to stimuli. That's especially true in food for a couple of reasons. One, our research shows you make about 200 food-related decisions every day, which means that you have a chance to make a newer and better decision in about 5 minutes. So you can always say, well, I'm going to reset myself in a few minutes. And two, because food plays the role in our culture and in our lives of comfort, when we're stressed out, the last thing we want to do is be disappointed by this thing that we're seeking comfort from. Which of these systems we use is highly dependent on what cognitive resources we have available. In other words, how stressed we are. So when you're running late, you get the extra shot of flavor when you're going through the Starbucks drive-through line, and you might get a brownie as well. Context in which we consider food makes a big difference too. We did a study here on campus where we took 56 adults on a 2-mile walk. Half the folks were told they were giving a tour of the very beautiful Cornell campus, and the other half were told they were getting a little exercise before lunch. The exercise group ate 35% more pudding at lunch. They also estimated they'd walked about 25% further, and that they'd been out for the walk a little bit, about 30% longer than the group that was just on a simple scenic exercise tour. Moral of the story is, for a lot of us, just going out for a walk and not really putting any specific expectations on it may be more effective from a weight control point of view because we're less likely to overeat afterwards. Mood makes a difference too. We did a study where we put people into two different groups. One group was asked to consider 5 things that were stressing them out. The other group was asked to consider 5 things they were thankful for. We then put them through a simulated food selection task. The group that had been asked to think of things they were thankful for made much healthier decisions, and they were much more likely to choose things such as salad over a brownie. Again, it's that issue of are we stressed or are we not stressed when we're making our food decisions. Kind of goes back to that old "don't shop when you're hungry" thing, that we've been talking about for years. We're also impacted by very, very small cues in not just how much we eat, but how much we enjoy it. This is a study that we ran where we brought a bunch of people in. We wanted them to do some menu evaluation, and we did them a bottle of wine as a reward for participating in the study. One group was told, so everybody had the exact same dining experience from cutlery to waiters to the exact same food menu and everything. The one difference was that one group, the bottle of wine that we gave them, they were told it was from California, and the other group was told the wine was from North Dakota, which is not noted as a collector state for wine. Not surprisingly, when we asked them to evaluate the wine later, if you look at the red bar there, it's almost 3 points higher for the California wine label. That's not super surprising because they have an expectation of what California wine tastes like, and nobody's ever heard of North Dakota wine unless you're from Fargo. However, when we asked them to evaluate the food taste, they also rated the food almost 1.5 points higher. They also stayed at their tables about 20 minutes longer. They rated the service more highly. They liked their servers better. And when we asked them if they'd be willing to participate in another study later, the people who had wine from California, they were about 90%. Yeah, this was fun. We'll do it again. The people who had wine from North Dakota were busy for the next 35 years. Fewer than 20% of them said they'd be willing to participate again. It's just an example of how one very small thing can have a huge impact on a complete dining experience. When we're working with schools, one of the first things we always tell people is move the garbage away from where the kids are eating. You don't want them thinking about garbage while they're looking for food. That has a huge impact on what you think the food is going to taste like. How things are described has a tremendous example. This is a paper we published last year showing the effect of putting names on the same items. One, a very simple descriptive name, and one, a more aspirational or fancy name. When it has a fancier or more descriptive or more interesting name, likelihood of selection goes up 27%, and there's a 10% increase in willingness to pay. In other words, they pay 10% more for satin chocolate pudding over chocolate pudding. Because by using the name, we've actually changed your expectation of what the flavor is going to be like, and so you're more likely to select something you think is going to be better, and you're willing to pay more for it. This is super important in the context of buffet eating or in supermarket. The order in which foods are presented to you has a huge impact on your selection. In a standard buffet, almost 70% of the food on your plate will be comprised of the first 3 items in line. And that's regardless of what the items are. We've done experiments where we've had the exact same items on 2 sides of a buffet, but they're placed in reverse order. In other words, on one side it's fried chicken, mashed potatoes, and gravy, the first 3, and on the other side it's fruit, salad, and cooked vegetable. And you take a picture at the end, and it's the exact reverse percentage. The first 3 things in line are the things you tend to take. So here's a pro tip for you if you're going out to lunch after this. When you're going to a buffet situation, walk around, see what you want to eat, and then come back and make your decisions. This works on a really practical level. In schools, we found that if you rearrange the milk cooler so that the white milk is first and more prominently displayed than the chocolate milk, and it comprises about 1/3 of the total milk on offer, you can increase selection of white milk about 46% without decreasing the total sales of fluid milk, which is really important for schools, which are always looking for a balance between revenue and serving a proper nutritional mix. By contrast, we've also seen in some schools where they banned chocolate milk, they had almost an 11% overall decrease in total fluid milk sales. Priming and simple suggestions, and here we're working directly into the retail area, has a huge impact on how people select. Since we're a lab at a fancy, I like to do very high-tech things. You look at this cart on the right-hand side. That yellow band represents some very high-tech duct tape that we placed around the outside of some shopping carts in some supermarkets where we did this intervention. That sign there just says, "Hey, put the fruits, vegetables, and low and lean proteins in the front half of your cart." That's all it said. No more direction than that. Afterwards, we collected the receipts of folks who had both the partition cart and the non-partition cart. The folks with the partition cart spent significantly more on fruits and vegetables than their targeted items, and in fact, overall, they spent about $12 more, and the share of basket went from just over 50 to almost 2/3 of the targeted item, just from a simple suggestion that was the social norm for what ought to be in the cart. So how do we kind of, the beginning of all the supermarket research, it started in 2009 when we had a visit from some folks in Denmark who were looking to do some interventions on how can they get people to shop more healthfully in schools. And some of you may remember that Denmark is the country several years ago, in 2012, which implemented the fat tax, and that was one of the techniques that they were going to do. In some cases, it was up to 35% of the tax on high-fat foods, and by contrast, they were looking for some other simpler interventions that we could do. So our response to how do you make people buy healthier? Well, human nature doesn't really respond particularly well to making, and this is a really good example of all you have to do to get kids to climb on the sign is put up a sign that says "Don't climb on the sign." I was just talking about the fat tax that was suggested. What they did was they actually did the fat tax on the main island and on the mainland, and then there's an island in the north, I guess that's the Baltic Sea, called Bornholm, and we were allowed to do a bunch of interventions out on that island. 8 of the stores on the island, which is about 42,000 people customer base, implemented some interventions. And we did some very simple things with partition carts, some grab and go, some labeling, some floor guides, and we phased that in over 2 years. I'm just going to run through these quickly. Here's a couple of examples of some of the things that they did. This is grab-and-go snack up by the register. Some floor decals pointing out some of the healthier items and the quickness that they can be used to, the time it takes to prepare them, along with some recipe cards. These are just some simple wayfinding, where if you put arrows in that direct people to go into the produce section, we find that people will spend sometimes 10 or 12% longer in the produce aisle. And other research has shown that every additional minute that a customer spends in the produce aisle actually translates into about another 65 cents per minute in purchases around the rest of the store, because produce usually requires other things to complete making it, whether it's spices, or it impacts your selection for the center plate items, such as the meat or main protein item. And as people, we tend to follow directions and guidelines. So here's another example. All this is meant to do is to people who might otherwise just go into the standard aisles for the canned and the packaged goods. Here they're sort of prompted to go into the produce section, and again to try to get that impact from being in the produce. They also tried divided carts. We already talked about how that worked. The takeaways from that research was that the items that we targeted with interventions, whether it was the wayfinding, or it was the suggestion in the cart, or some simple signage, they had an increase in sales. And because we gave a little bit of flexibility to the stores, they were willing to take on things that they thought would work. They made more money. They had a little bit less spoilage of high turnover items that tend to go bad, such as fruit and vegetables. And as we were kind of parsing through these things a little bit later, we realized, well, we actually only gave them 8 changes to choose from, but from our research, we know there are many other options. And we started to pull back on, and Amy referenced this earlier, we started to think about some things we had been experimenting with in schools. And this is a snapshot of the Smarter Lunchroom's 100-point scorecard. One of our research initiatives funded by USDA is work in schools around the country, and we've done experiments in around 1,000 schools around the country now, showing that simple behavioral changes made in the school environment can dramatically impact what the kids select, and more importantly, what the kids actually eat and what they select. So things like naming of vegetables, how things are ordered on the line, how you set up the milk and dairy cooler from the point of view of nudging kids in direction without limiting or restricting or overtly limiting their choices, which leads to reactance and people being annoyed that you're trying to tell them what to do. So this is the scorecard. We put it together based on our research in schools, and also some of the things that we had done similarly in retail space. The scorecard's been very widely adopted across the country. It's actually part of the USDA's Healthy U.S. School Challenge Certification Program, and it's been used by several thousand schools around the country now. The Alliance for a Healthier Generation also uses it as part of their behavioral criteria, as well as a couple of other institutions, including the Nutrition Institute for Children. So the takeaway from our work with that scorecard is that scorecards can be very effective tools for making changes in public environments. That they work particularly well, and you can see on the slide here, they're evidence-based, if they have a third-party endorsement, if the changes are easy to make, if they can be kind of a mix and match. It's not prescriptive in terms of, yes, you must make all of these 100 changes, but if you kind of go through and let them pick out the ones that they're most comfortable with, and they can make, in other words, that they can grab the low-hanging fruit with, then people are much more willing to adopt and actually and maintain them, which is very important from an efficacy point of view. And of course, if there's some bragging rights involved. So we've noticed that within a school district, if one building gets 45 and another building gets a 47, then there's a little bit of a competition between the two, friendly competition. And I think I could probably get to 49. All I have to do is change 3 simple things. And that's the whole point, is to make it as simple and easy to do as possible. And to make it aspirational. There are always things on there that are going to be difficult for people to do. And that's by design, because we want them reaching and thinking and trying to make themselves better, even when they've done all the simple stuff. So transitioning that into the supermarket environment, where the majority of people's food choices are made, actually, at least their big macro choices are made. So we thought, if we take a bunch of these things and reformulate them slightly for the supermarket environment, we can come up with a tool that's just as effective in supermarkets as what we have put together for schools, and give another tool to the industry for it to rate itself, and also to serve as kind of a guideline for behavioral changes that can be made in that space that encourage consumers to make healthier choices. One of the things we typically hear from industry, whether it's a CPG company or a big food manufacturer, or if it's a retail chain or a restaurant chain, they will say, well, we've introduced healthy items. People tell us they want them, but then when we present them with them, they don't buy it. Right? So oftentimes they're marketed, hey, these are the healthy things. And we know from other research that for most people, healthy does not equate to flavorful or indulgent or things that we really want to spend our extra dollars on. So the idea behind setting up the environment in a way to support choices is to give retailers the tools to help people support choices, goals that they say that they have made, that they may not be necessarily supporting when they're making their own choices. So if the majority of our food choices are made through either habit or convenience, right? So if I can set up a food selection setting, and you saw this in how the buffet is ordered, how that impacts choices, so that a piece of fruit is easier, significantly easier for you to access than a piece of candy, some number of people are going to take a piece of fruit and say, you know what, this actually satisfies my craving just as well. I'm happy with that. They got to make a choice. They weren't prevented from selecting the candy. They were just nudged into a healthier decision, and thereby supporting their own goals. So that was the idea behind bringing the school scorecard to the supermarket. So the scorecard is for ease of use for those scoring the scorecard. It's organized by, while the school scorecard is organized more by category of promotion, the retail scorecard is organized by area of the store to make it easier for evaluators to kind of go through and tick things off as they're doing it. And here's a couple of examples of some things that are in the scorecard. So, for example, in the entrance of the store, is there a display of high-calorie, low-nutrient, free of high-calorie snacks? Can we get, are there healthier foods that are right in the front? Because we take advantage of that priming notion of seeing the healthier things first and kind of impact what we choose further on. Can they have divided carts? And the prepared food area, is fruit an option everywhere? Is the fruit displayed? We know from our work in schools that if you display fruit in a nice basket versus just in a hotel pan, kids are much more likely to select it. The same thing works with adults. The small bit of care that is perceived to take to put a little effort into display gives people the impression that things are tastier and more likely to be satisfying. In the checkout, is there a no candy line? Every mom likes that anyway because it avoids the argument, but in that no candy line, then maybe we have some cut vegetables the kid can snack on while going through the checkout. And are there healthy snack options available in all the checkout lines? Just a few little pressure points around the supermarket where we know choices are going to be made, and if we set up a healthier option along with the other option. So, for example, in the cracker aisle, when you're featuring a specific cracker, are there whole grain options available as well? And do they have equal representation to the more traditionally thought of as indulgent snack item? Gives that a little bit more oomph, a little more exposure, and a little more likelihood of being selected. So once we come down, initially we put the scorecard together very much like the school scorecard in that it had 100 questions to it, just because 100 is a number that everybody is familiar with. And then we took it out for a test drive to see how it worked out in the real world. So we did a whole bunch of iterative reliability. In other words, do two people of similar experience, do they come up with the same score on when they're evaluating a retail environment? And all of the scores are either yes or no. We decided you get much better iterative reliability if you have a yes or no question. Once you start scaling things, then a lot more opinion goes in. If I ask you, does the store offer divided carts? Well, somebody might miss it, but it's an easily answerable yes or no question. We go look at the carts. Are they divided? Yes or no? It's very simple, so we can end up with a nice agreement there. So we got really good response in the iterative reliability. And a lot of And a lot of the questions where there was some disparity also overlap with some things where there were some usability issues. So it was very easy for us to kind of move through and call out some of the things that were problematic. And so we actually started calling out some of the questions. And one thing that was very interesting that I think Sarita will talk about was the impact of that. I mentioned at the beginning that we had 100 points. And we have definitely seen this in schools where in the 100-point section, as soon as you show them 100 in a school, everybody wants to get 100 out of 100 because that's a perfect score on the test. The tool is designed so that nobody can get 100 points, and I'll let Sarita talk a little bit more about this. But this notion that the 100 points was just really a problem, and that people were just so fixated on it. So we were actually happy to have an excuse to remove some of the questions that either had some issues with the iterator reliability or were just a little bit harder to judge overall. And I'll just go over to Sarita's slides and making some work here. And Sarita, I can advance your cards, your slides when you'd like, if you just want to tell me.
All right, thank you, Adam and Sarita. I will turn over to you to discuss the retailer's response to the scorecard.
Wonderful, and thank you, Adam. Yes, you can advance the slides for me. So I don't think you guys heard me during the original introduction. My name is Sarita Moss. I work for the University of Delaware at the Center for Research in Education and Social Policy. And this summer, I conducted the retail scorecard interviews with Allison Carpin, and I will provide you with the overall feedback. So the purpose of our research this summer was to get a general understanding of what retailers thought about the scorecard. It was the first time that we systematically engaged a wide range of retailers for feedback regarding the tool. Overall, we conducted a total of 17 interviews, and we had several aims. The first was to understand how retail-friendly the scorecard is for implementation by the store managers. Our second aim was to understand the scope of implementation concerns and the potential motivators among the store managers. We also wanted to understand implementation concerns and motivators among the C-suite executive leadership. And finally, we wanted to gauge how likely the stores would be to game the system as well as receptivity towards verification approaches. So Adam, if you could go to the next slide. Basically, thank you. So our thematic findings centered on three main categories: feasibility, motivators, and scoring. Overall, the retailers were generally receptive. They really believed in the concept of the scorecard. Some of the retailers felt the items were clearly worded, and they felt the strategies were familiar to them and thus doable. Some of them actually remarked that they were aligned with the tactics already being implemented. In terms of motivators, internal motivators often aligned with the company's existing mission and objectives, and so therefore it aligned with their priorities. Motivators, specifically internal motivators, were dominant. Among those, the managers believed that it would motivate them if it was centered around incentives or internal rankings among the stores or within the retail store. Now, in terms of external motivators, they were a little tricky. Competition and ranking were important, but there was also pause for a compatible comparison among retailers. Specifically, for example, not gauging or comparing a Meijer to a Walmart superstore or to a Costco. The retailers were also concerned about negative press for low scores. And Adam, if you would advance the next slide for me. In terms of the overall findings, there were generally 4 sets of recommendations that came out of the research. One, the retailers made it known that their goal is to provide the customer with options rather than limitations. So we were advised to reword questions that appear to inconvenience the customer. Also, in terms of the length of the tool, it often posed a challenge for some of the retailers. So it was suggested that we would reduce, or we should reduce the length of the tool. And then not just reduce the length of the tool, some retailers actually suggested that the categories, there be subcategories. For example, the original scorecard made a distinction between fruits and vegetables. However, retailers tend to think of them synonymously, so they're the same for the retailer. And then, as Adam mentioned, in terms of the adjusted scoring, so not only was a shorter tool more appealing from a feasibility perspective, the length of the items, in terms of that 100, the 100 items appear to be daunting to retailers, but it also evoked notions of pass-fail. And so some retailers were disappointed if they did not get an A. And so to ease that anxiety regarding the scoring in A, it was actually recommended that we broaden the scoring category. Let's see. Is there another slide for me, Adam? Okay, so for example, and this is, again, so rather than based on that 100 scoring category, when there being levels of A, B, C, or D, or bronze, silver, or gold, rather than having it categorized that way, expanding or broadening that category so that there would be an idea of a good effort, or at least a C even for participating in the scorecard itself, or attempting to implement the scorecard itself. And then, do I have another slide, Adam?
Add to that, there's just a final wrap-up slide, I guess. Can you guys hear me? Are you hearing me?
I can.
Okay. Yeah, so there's, then just to follow up on the scorecard, we've seen through some of the schools, if people can't start near the bottom, if you have if the base score is somewhere in the 30s, and people aren't getting rewarded for that, they're much more likely to say, you know what, we're not even going to try because we can't even get to the base level. So if we can get them started out near bronze, and then they're much more likely to aspire to move up to silver and to gold. And all of this allows them, this scoring system allows them to really easily pick and choose around the store where they think they can get the most bang for their buck and the easiest place to start. Then we just have one last kind of wrap-up slide. So we've integrated all of the choices, all the suggestions that came back from Sarita's team in the field testing, and actually Brian Wansink, who's the leader of the Food and Brain Lab, is currently on sabbatical in Norway, and they've actually been field testing some of these interventions in supermarkets in Norway. And he recently had a circumstance where they had a 40% spike in sales of fruit and veg by using some of these simple thoughts with the wayfinding. So pretty much we're ready to go and get this thing out into the big wide world. We've got a little bit more formatting to do, but we're really glad that you guys are on the phone and are really interested in working with us. And at this point, unless you have something additional, Sarita, I think we're ready for Q&A.
Okay.
Thank you both so much. We just had one other topic before we move into the Q&A by our representative from PHA speaking to us about organizations using the scorecard. And if any of our ICCR members do have a question, just to remind you to click the raise your hand button. After we hear from PHA, we'll move into our Q&A section.
Sorry about that, Sue.
Hi there, this is Pamela Long with PHA. Can you hear me?
Yes.
Hello?
Hi, yes, we can hear you.
Okay. I'm getting a lot of feedback. All right. So a quick overview. Partnership for a Healthier America has been around for about 5 years. We started back in 2010 in collaboration with, but separate from, the First Ladies Let's Move campaign. I'm still getting a bunch of feedback.
Okay. Sorry, this is Mary. I have everyone else muted, so I'm not sure what the cause of the feedback might be. Are you on a speakerphone, perhaps?
I am.
Okay. Is it possible for you to pick up the line?
Hello?
Yes.
Okay, well, I'll continue. I'll make
Okay,
this
that
brief.
sounds better.
The Partnership for a Healthier America, our goal is to solve the childhood obesity crisis within a generation. And our approach to do that is to develop public and private partnerships, bringing various partners from industries, be it food, beverage, financial, health, corporations, community-based organizations, non-government organizations, and other government agencies. And doing so, we want to make sure that we are putting programs into place that will actually solve the crisis by giving communities, organizations the opportunity to have measurable and verifiable results as it relates to food consumption, physical activity, nutrition choices, and I think that's probably the big buckets. With the scorecard, we are looking to obviously work with major grocery retail chains and help them understand the importance of educating consumers on how to find healthy choices in the grocery store. So by going through the tutorial today, which was great, thank you very much, Adam and Sarita, we will be approaching larger retailers across the country, sharing with them the scorecard and how they can use it to perhaps change the outline or the layout of their store so that, you know, some of the things that Adam presented to us, you know, healthier choices are close to the entrance, or there are less tempting non-healthy choices in checkout lines. It will be part of a larger commitment that we ask for from our partners, but this will be a very significant component to it. And moving forward after this call, we will start to engage directly with various different grocery retailers that have been a part of this process and those that have not. So that's what Partnership for a Healthier America plans to do moving forward. If there are any questions, we'll be happy to answer.
Thank you so much. All right, we can go into our Q&A section. I believe, Mary, we did have one hand that was raised.
I'm sorry, I was muted. I'd like to please ask people to click the little hand icon if they have a question. We have one here from Donna Meyer asking, what are plans for field testing? I don't know who wants to pick that one up.
Yeah, so this is Adam at Cornell. So we've done quite a bit of field testing. We started developing the scorecard in September of 2014, and we organized a panel of retailers here on the Cornell campus. They included folks from Ahold, Hannaford, Target, Meijer, who am I forgetting, Julie? A couple of other folks. And they've all used the scorecard in their stores, and that's where we got some of the initial feedback. Now the final set of the tool as it exists now, following that feedback and the feedback from Sarita and her team, has been set, and we had a similar webinar to this about 2 weeks ago with the folks at Target who are looking to roll this out across to their stores. I'd say that we're well beyond the basic field testing at this point, because we've been through a number of iterations of testing with various entities. So we're looking for kind of a wider rollout, and actually I should reword that on my final slide there. We're looking for a wider rollout for retailers to really kind of go and implement it. And if they have additional feedback at that point, we can make changes as needed. But I think we're pretty ready for a real rollout at this point.
Okay, great. We have another question here from Kathy Rowan. What's the best way we as investors can support PHA's outreach to retailers to use the scorecard? What would be the right timing for us to reinforce your outreach?
This is Adrienne Weil. I'm also with PHA. In terms of the timing, we want to make sure that we're as coordinated as possible. So if there is any intent to reach out to those folks, if you can just reach out to Pamela first, we'll make sure that we're all singing the same tune, and we can let you know where we are in the conversation itself. But would absolutely appreciate if there are any conversations that are already happening that you can encourage folks to be speaking with us and reaching out to us proactively as well. Commitments with PHA happen in a variety of ways, and often from multiple people recommending organizations and companies that speak with us in addition to our proactive outreach. Does that help?
Okay, just a sec. I'm going to unmute Kathy Rowan for a follow-up. Kathy, go ahead.
Yeah, that is helpful. Thank you. What's the role? What would be the role of the consumer packaged goods companies in wanting to see this scorecard used? Is that something we should be raising with those food companies and food and beverage companies as well in our dialogues?
I'm not part of the organization, but this is Adam at Cornell. My response to that would be yes, because of that, this can help to address that issue where the consumers are saying one thing in terms of what they want and not necessarily following through on their actions. So, I mean, every CPG and the manufacturing company has a story about a product that they launched that was supposed to fill a health niche that didn't do very well. So, with most of the companies now trying to do something in terms of either portion control or introducing new products or trying to address their nutritional, for lack of a better word, the deficiencies in sales. Anything that helps the retailers increase the selection and purchase of items that would be considered better for you or more helpful has got to be a positive for the manufacturers also.
Thank you.
Okay. Hi, this is Julie from PNW. Just want to build on Adam's response. In some of the meetings about this tool, as we were developing it, a good suggestion was made by some of the larger retailers to make sure that their buying staff and store operators were familiar with the tool up front, so that some of the tactics on the tool could be built into marketing and trade allowance negotiations for the following year. So that's just one specific suggestion of ways for this type of tool to trickle down into the CPG world as well.
Okay, Donna has her hand up. Donna, I've unmuted you. Go ahead. Okay, perhaps that was a mistake. Does anyone else have a question?
Okay, well, it looks like we don't have any more questions from our ICCR members, and we are just about at the end of our hour together. I do want to thank everyone from the Convergence Center, from PHA, University of Delaware, and Cornell. Thank you all to our speakers for speaking with us today and for providing us with more information about. We really appreciated your time.
Thanks. Our pleasure. If you have more questions, let us know.
Thank you.
Hi, everyone.
Thank you so much.
Thank you all. Have a good day.
Bye now.